5 health checks that could save your life after 70. And many people are ignoring them. There's a quiet truth that most older adults and their families discover far too late. Every year, millions avoid certain checkups, thinking, if nothing hurts, I must be fine. They believe the absence of symptoms equals good health. But what if I told you that some of the most dangerous conditions at this age show no symptoms until it is already too late? That simple, often ignored tests could be the difference between an active, independent life and a sudden decline. New analyses and medical consensus suggest that while overdiagnosis is a risk, underdiagnosis, failing to catch what truly matters, is an even greater threat. Skipping these vital screenings can open the door to falls, a loss of independence, and devastating conditions that could have been managed. What is most alarming is that most people over 70 don't know which of these checks are truly crucial, because they aren't the ones you always hear about in the news. You won't hear this in a marketing campaign. You won't see it on a billboard. But the scientific evidence is clear, and today, we're bringing it to light. In this video, we will reveal the 5 health screenings that experts like Dr. Laura Rodriguez say you absolutely must discuss with your doctor after age 70, all backed by science. And trust me, you won't want to miss the one at number 2. It's a checkup almost no one connects to overall health, yet its consequences are massive. Before we begin, tell us in the comments where you're watching from and what your age is. Have you ever postponed an important test? Or did a screening catch something critical just in time? We read and respond to every comment. And please don't forget to like this video and subscribe for more content just like this. Now, without further ado, let's talk about the first screening. It's so fundamental that it's often overlooked, but it is the foundation for everything else. Screening number 5, the comprehensive medication review. It sounds simple, doesn't it? But it's one of the most critical and undervalued checks. After 70, it's common to be on multiple medications from different specialists for blood pressure, cholesterol, diabetes, pain. But here's what nobody tells you. This mix of drugs, known as polypharmacy, can be a ticking time bomb. One drug can cancel out another or, worse, create dangerous side effects like dizziness, confusion, or weakness, which are often dismissed as just getting older. Experts like Dr. Laura Rodriguez insist that an annual review of all your medications with your primary doctor is vital. The goal is to eliminate what's unnecessary, adjust dosages, and ensure there are no dangerous interactions. Consider the case of Arthur, a 79-year-old who suffered from constant dizziness and was at high risk for falls. His family assumed it was just his age. After a thorough review, Dr. Rodriguez found he was taking 2 medications with similar effects that, when combined, were dangerously lowering his blood pressure. By adjusting the medication, his dizziness vanished within a week. Don't assume that because a doctor prescribed it, it's safe forever. Ask, question, and demand a full review. It could change your quality of life overnight. Screening number 4. The cognitive baseline assessment. When an older adult starts becoming more forgetful, the immediate fear is Alzheimer's. The knee-jerk reaction, as we discussed in our previous video, is to order an MRI, which can create more anxiety than answers. But here is the proactive approach that actually works: a cognitive baseline assessment. This isn't a brain scan, but a series of standardized tests that measure your memory, attention, and problem-solving skills. Why is this so important? Because it establishes a map of where you are right now. Experts like Dr. Rodriguez explain that having this baseline allows a doctor to spot subtle changes over time. Sometimes a slight decline isn't dementia, but the result of an infection, a vitamin deficiency, or even depression, conditions that are highly treatable. The case of Martha, 82, is a perfect example. She was becoming more forgetful, and her family feared the worst. Her cognitive assessment showed a mild decline. Instead of assuming dementia, her doctor investigated and found a severe vitamin B12 deficiency. With simple treatment, her mental sharpness returned to normal in a few months. Getting a baseline assessment isn't about looking for a bad diagnosis. It's about smartly protecting your brain's future. Screening number 3, the eye exam for glaucoma and macular degeneration. But I can see fine to read. It's a phrase many seniors say while a silent disease could be stealing their peripheral vision. We're talking about glaucoma, often called the silent thief of sight. It has no symptoms in its early stages. By the time a person notices their field of vision has narrowed, the damage is already irreversible. Dr. Laura Rodriguez is firm on this. After 70, an annual eye exam that includes measuring your intraocular pressure is absolutely essential. Catching glaucoma early allows for treatment with simple eye drops that can stop its progression and save your sight, your independence, and your ability to move safely. This checkup also screens for age-related macular degeneration, another leading cause of blindness that, when caught early, has treatments that can dramatically slow it down. Don't wait until you can't see well to get your eyes checked. Screening number 2, the audiometry or hearing test. This is the screening you probably didn't expect, but listen closely. Hearing loss isn't just an inconvenience. It is a significant and proven risk factor for social isolation, depression, and, shockingly, cognitive decline. Why? Because when the brain stops receiving clear auditory stimulation, the areas responsible for processing sound can begin to weaken. Furthermore, the constant mental effort of trying to understand what people are saying consumes a huge amount of cognitive energy. Dr. Laura Rodriguez tells the story of Michael, 81, whose family noticed he was becoming withdrawn and confused. They assumed it was the start of dementia. However, a hearing test revealed severe hearing loss. With modern hearing aids, Michael began participating in conversations again, his mood lifted, and his confusion disappeared. A routine hearing test can be the simplest intervention with the biggest impact on your quality of life and your brain health. It's not vanity, it's health. Screening number 1, the coronary artery calcium CAC scan for people over 70, especially those with risk factors like high blood pressure, high cholesterol, or a family history of heart disease. The traditional stress test can produce false positives, leading to unnecessary invasive procedures. But there is a far more accurate and less risky test, the coronary artery calcium scan. It's a low-radiation CT scan that requires no prep and no contrast dyes. Its sole purpose is to measure the amount of calcified plaque in your heart's arteries. Dr. Laura Rodriguez puts it this way: it is like taking a direct snapshot of your risk. A score of 0 means you have an extremely low risk of a heart attack in the coming years, providing immense peace of mind. A high score, on the other hand, allows your doctor to act proactively with medication and lifestyle changes before an event occurs. This test avoids the cascade of unnecessary procedures that an ambiguous stress test can trigger and gives you and your doctor a clear roadmap to protect your heart. It is one of the most powerful preventive tools available today. So there you have it. 5 screenings that, instead of creating fear, give you power. The power of information, of prevention, and of making smart decisions with your doctor. Modern medicine isn't just about treating disease, it's about anticipating it. As Dr. Laura Rodriguez always reminds us, the true key to healthy aging is combining an active lifestyle with intelligent, targeted medical oversight. Now, we want to hear from you. Is there another checkup you believe is vital? Has one of these tests helped you or a loved one? Share your wisdom in the comments. Thank you for watching.